Brain-eating amoeba Naegleria Fowleri. What is brain-eating amoeba or Naegleria? A free-living amoeba is called Naegleria, a single-celled living organism. Only a microscope can see it because it is so tiny. How does brain-eating amoeba or Naegleria Fowleri infect people? When a person inhales water contaminated with the amoeba through the nose, they become infected with Naegleria Fowleri. The amoeba then enters the brain through the nose, where it destroys brain tissue and spreads a deadly infection known as primary amoebic meningoencephalitis, PAM. Where is brain-eating amoeba Naegleria Fowleri found? The amoeba can be discovered in any freshwater body of water in the United States, regardless of the state, but especially in the summer months of July, August, and September. It can survive for brief periods at even higher temperatures and grows best at high temperatures up to 115 degrees Fahrenheit, 46 degrees Celsius. In what water temperature does brain-eating amoeba Naegleria Fowleri cause infection? It can survive for brief periods at even higher temperatures and grows best at high temperatures up to 115 degrees Fahrenheit, 46 degrees Celsius. Can I get a brain-eating amoeba or Naegleria Fowleri infection from a properly cleaned swimming pool? No. A pool that has been regularly cleaned, tended to, and disinfected cannot cause Naegleria Fowleri infection. How common are brain-eating amoeba or Naegleria Fowleri infections in the United States? From 2012 to 2021, there were 0 to 5 new cases diagnosed each year in the U.S. Of those cases, 28 people contracted the disease after coming into contact with recreational water, 2 people contracted the disease after using contaminated tap water to rinse their sinuses, and 1 person contracted the disease after using contaminated tap water on a backyard slip and slide. When do brain-eating amoeba or Naegleria Fowleri infections most commonly happen? When it's hot outside, infections frequently occur, raising water temperatures and lowering water levels. What are the symptoms of brain-eating amoeba or Naegleria Fowleri infection? PAM is a brain infection brought on by Naegleria Fowleri that damages brain tissue. Headache, fever, nausea, and vomiting are just a few of the symptoms. The first PAM symptoms typically appear 5 days after infection, though they can appear anywhere between 1 and 12 days later. Is there effective treatment for infection with brain-eating amoeba or Naegleria Fowleri? It has been difficult to find effective treatments for PAM due to its rarity and the infection's rapid progression. Amphotericin B, azithromycin, fluconazole, rifampin, miltefosine, and dexamethasone are currently used in combination therapy to treat PAM. Is there a routine and rapid test for brain-eating amoeba or Naegleria Fowleri in the water? No. How can I prevent infection with brain-eating amoeba or Naegleria Fowleri? Self-diagnosis or using this information in place of consulting a healthcare professional are not intended uses of it. Consult with a healthcare professional right away if you have any concerns about the amoeba mentioned above or believe you may be infected. Find us at